promised, we're going to look at bipolar mood disorder today.
So, Jaco, what is bipolar disorder?
Bipolar mood disorder is a lot more than just the up and down of emotions. People sometimes link bipolar with people that's got rapid changes in the mood, fluctuating up and down, but it's much, much, much deeper than that. It is a psychiatric illness that is chronic, so therefore it should be managed and maintained throughout life. The thing that I just quickly want to mention, if we do look at the graph, there's two types of bipolar. We're just going to go into that on a later stage. But when we look at bipolar, we speak about mania and hypomania. That is the high of the mood, followed by a depressive episode that can go very deep and down, like depression on its own, like an episode. There's also the cyclothymia, that the difference between them is it's an up and down, but not manic and not major depressive. And that can fluctuate throughout a 2-year plan. So Este, according to you, what would you say are the difference between mania and hypomania?
So, mania would be an extreme mood condition which is characterized by an abnormal level of energy, lower need to sleep, impulsivity, racing thoughts, and sometimes psychosis. So, hypomania can have the same symptoms, but it is not that severe and does not require hospitalization. So, how does bipolar differ from ordinary mood swings?
Okay, so ordinary mood swing is literally the up and downs people experience in a day. But bipolar mood disorder is that deep symptoms that reach a criteria. What do you think causes bipolar?
I don't think there's one specific thing that causes bipolar disorder. Research says that it is a combination of biological, environmental, and genetic factors. If you have someone in your family that do have bipolar disorder, your risk would be higher to develop that. But it is not necessarily so that you will develop bipolar disorder. Jaco, can bipolar disorder be cured?
Bipolar disorder is a chronic condition, and if one experiences a manic or hypomanic episode even once in your lifetime, we can make the diagnosis of bipolar mood disorder. However, we should think of it like diabetes. You need to take insulin for the rest of your life. So with bipolar, we're not going to go into treatment and medication, but we need to have a mood stabilizer pretty much for the rest of your life. So it can't be cured currently, but it's definitely very, very well managed. So Este, why do you think people with bipolar disorder sometimes stop their medication?
Yes, there are different reasons. Firstly, a lot of people dislike the side effects of the medication. And secondly, we see that the moment people start to get better, they think that they can stop the medication because they are better. Other people would miss the energy and the confidence they had in mania or hypomania. So it's very important to realize that you cannot just stop your medication without medical supervision because the risk of a relapse is very high. So Jaco, what would early warning signs of a manic episode be?
Okay, so the first thing, a decreased need for sleep. You are more irritable, agitated. You talk excessively. There can even be impulsivity or recklessness, whether it's sex, spending, anything in that sense where we are hyper. So, Este, how can a family member or people in a person's life support a person with bipolar?
Yes, that's very important for family members to also gain a lot of knowledge about bipolar disorder. The more you know, the better you know how to deal with that. But it's also important to encourage treatment compliance and a healthy lifestyle with the person who has bipolar disorder. And also, most important is for you to also recognize the first early warning signs or the red lights when an episode starts. Just remember that family members also need to take care of their own mental health. I think it will be a good thing if you are a family member to go and see a psychologist for 1 or 2 sessions just to get guidance about that specific person with bipolar disorder. Can people with bipolar disorder have successful careers and relationships?
Definitely. Bipolar disorder, although it's a severe psychiatric condition, it can be treated very effectively. So, yes, there are so many people, millions of people in life that has this diagnosis. Bipolar can be seen in a lot of professions, from lawyers, teachers, wherever. Bipolar is such a common diagnosis, although severe, it can be treated very effectively. What would someone do if they think they might have a bipolar mood disorder?
I think it's very important to make an appointment with a psychiatrist or a psychologist, someone who's registered with the medical council, and let them assess you and help you from there on. I know a lot of people nowadays diagnose themselves from the internet, but that is quite dangerous because bipolar disorder can overlap with other mental health disorders and also with physical illnesses. So see a real doctor or psychologist and get diagnosed, and from there on you can get treatment.
So, Este, what tips do we have for people suffering with bipolar mood disorder?
I think with bipolar mood disorder, as with any other mental health condition, the first step is to learn as much as you can about your disorder. The better you know it, the better you can monitor yourself, and the better you know when to go for help.
Another tip that we can look at is to encourage treatment. Now, this is just an example I use in therapy where we have this idea of, I'm just going to quickly show, we write certain symptoms in the middle, like decreased need for sleep, appetite changes, whatever it is, the symptoms of a mania as well as the symptoms of depression. Then you'll see there's a red side and a green side. So when we turn this upside down, this could be a nice way to monitor and evaluate your symptoms and where you are currently at. So I always say if there's a symptom like a decreased need for sleep and you experience that in a sense of a 3, and we can then start to monitor. I always say when the score is 1 and 2, a patient can deal with that on their own with certain skills they've learned. When it's a 3 and a 4, definitely consult your psychologist. And when it's severe, like a -5 or a 5 out of 5, you need to consult with a psychiatrist.
Recognize early warning signs. The sooner we pick up the warning signs, the better we can treat you. I always speak about red lights. So I teach my patients what their specific red lights are because each person will have different red lights. If I can give you 2 examples, I saw men in the past that said the moment their wife paints their fingers a bright red, they know it's the start of a manic episode. That would be a red light. I also saw patients who says if they are in conversations, they can't stop talking. They just keep on talking. That's their warning sign. Other patients would say that they stay in bed the whole time and they don't want to get out of bed. That's a warning sign.
Another tip could be to avoid any big decisions during any kind of episode. When our mood is too low, it's not ideal to make a decision for the rest of your life. Or even so, if you're manic, we tend to be reckless, impulsive. And to make decisions then can have a lot of not just monetary problems, but also the consequences of every word and action we take. So avoid making big decisions during the time of a manic, hypomanic or depressive episode.
And then also look at healthy routines. That's the first step in treating any mental health disorder. Sleep is the most important. We can't start to work with any mental disorder if we do not treat a sleeping pattern where you sleep at least 7 to 9 hours a night at the same times. So sleeping, first try to fix that, then eat healthy, and exercise is always good to help with any mental health disorder.
Also, we need to communicate clearly and calmly. We tend to get super excited, like we've got pressured speech, like Este mentioned, we can't stop speaking or talking. So it's important to communicate to your partner, to your family, to your work colleagues. Listen, and a nice way to do that is to give a score out of 10. So today I'm feeling a 3 out of 10, so just bear with me as if I'm a 3 out of 10. If you're good and happy and excited with a 9 out of 10, you can get more things done.
Have a crisis plan. It's very important to identify people in your life. We speak about ICE, the acronym ICE, in case of emergency. So recognize ICE people in your life that you can contact as soon as you notice the early warning signs. Also be open to those people telling you that they see the signs. And then also contact your psychologist or your psychiatrist. I always tell my patients, if you see red lights and your next follow-up is in a month, don't wait until then. Contact me the moment you see the red lights.
Another one is to set healthy boundaries. We did discuss boundaries in the past, but I think the ability to say no without feeling guilty, that is a thing we can discuss maybe in the future as well. Boundaries, effective boundary setting. But a healthy boundary would be to communicate, like I mentioned, and to say, listen, I feel sad with the way you speak to me. No, I can't do this now. I will get back to that in a later stage to manage your time better. And remember always, no is a complete sentence. You don't need to elaborate and say what is going on. You don't need to explain yourself. And also, if a person can't respect your no, always say, please respect my no.
Then remember, you are not isolated. You are in a family, you are working with colleagues. So it is important to tell them that at times you might be irritable, withdrawn, impulsive, or perhaps say nasty things. This is not an excuse to do that, but let them know that at times, if this happens, they must not take it personally. It's part of this mental health disorder.
The last tip we can give is to look after yourself too. Put yourself and your mood and your emotions in the foreground. Face it, feel it, work through it, and consult people that can help and assist you.
In conclusion, bipolar disorder is not a flaw in your personality. There's nothing wrong with you. It's a medical condition which can be treated the same as any other medical condition. So stand tall, be proud of yourself.
If you need to get more information or just have a lot of questions, please do not hesitate to contact us at the information that you see below. Be good, take care.